Hey everyone, it's Mary Ann Pizzatola, President of the New York City Organization of Public Service Retirees. I am here with the last installment of this four-part video. It was in reference to the video that the webinar that we held today, April 22nd. It was a 2-hour webinar that we were educating actives and active employees and union leaders regarding the differences between traditional Medicare and Medicare Advantage. As I said in the other videos, we did send all the unions and some, put this out to active members on social media, this letter inviting them to an event today. And then on the back is the traditional Medicare with supplemental plan versus the new Medicare Advantage plan. What's the deal? And we wanted them to understand the difference, because when you're young, you don't really know the difference between Medicare, Medicare Advantage, what the difference is, what the benefit is, and you're like, I don't need that now anyway, it doesn't really matter. But actually, it does matter, because you don't need to be negotiating away a benefit that we broke our rear ends to earn. So we want to finish this last part, and we want to explain to you these last two parts of this letter. So other insurance, you can have no other insurance, no PDP plans, prescription drug plans, no private prescription drug plans, no coordination of benefits. And what we did was we went on the internet and we found a bunch of videos, and there was a couple of them on our Facebook page as well that we had saved from different organizations, so NYCMLC, the New York State Nurses, the Sergeants Benevolent Association, the Captains Endowment Association, some from DC 37. So we took them all. We were looking to see which videos had the parts that we wanted to share. And we've shared with you some of those videos today, and in some of the other videos that are up on our YouTube channel. If you don't know where our YouTube channel is, go to our website, nycretirees.org. And there you'll find a link to our Facebook page and a link to our YouTube channel. We have a really good following. Click subscribe so that you can watch our videos, or you'll be alerted, when we do have a new video up, like when these four go up this weekend. So let's start with number one, no other insurance or PDP drugs. Or drug plans. So to explain what that means, I'm going to bring you to the evidence of coverage, which is the contract and evidence of coverage document by the City of New York, with the Alliance, of course. And that should be here. Okay, and so I want to go to page 226. Okay, so in this section, this lets you know that provisions for current retirees, all Medicare retirees, eligible dependents, age 65 or over, will automatically be enrolled in the New York City Medicare Advantage Plus plan. Retirees who do not wish to be enrolled in that plan effective January 1st will have the ability to opt out and remain in their current retiree health plan only. Retirees will not have the option to transfer to another plan until the full transfer period, which is effective January 1st of 2022. So this is an old part. Obviously, this is an old contract. Actually, this is 225. 226, all future transfer periods, retirees only have the option of transferring to the New York City Medicare Advantage Plus plan or the GHI Senior Care. And that was going to the point in the last part that we did, that there are no other choices. Here, CMS guidance does not allow a network-based Medicare Advantage plan, LPPO HMO, to be offered with an individual Part D waiver plan. If the Medicare Advantage plan is being offered with another carrier's Part D group waiver plan, the Part D carrier must coordinate care with the empire. CMS requires 800 series MA and standalone PDP plans to coordinate care. Per chapters 12, 20.1.8 and chapters 9.30.8 in CMS Medicare's manual, our pricing assumes that any group Part D plan carriers offered to the City of New York members will abide by the CMS requirement. The statement does not preclude Emblem Health from offering a group standalone PDP plan to the City of New York. Now, where does that come from? The city is offering an Empire plan, and that plan is $125 a month. That is their high option rider, is what it's termed. But you cannot have a private prescription plan. If you do, you will be automatically disenrolled. And I'm going to let you hear that in a moment. Let's see, that would be the video. I'm going to share that screen with you next. Oops. You will be able to hear Kim Parker in this video with the Sergeants Benevolent Association. This was filmed August 23rd of 2020, and I am going to 36 minutes and 40-second mark. Let me just make sure you can hear my sound. And here we go.
Have benefits, so they're getting, and they even get pensions. So some of our members have TRICARE, some of our members have the New York State Health Insurance Plan, where they coordinate benefits. How will coordination of benefits be applied to the new MA program?
The Medicare Advantage programs will not coordinate with other programs. So it's going to be either or is how the program would work. So it would not be in place to pick up copayments.
Okay.
Now, that's a problem, because if you have people that would have had their TRICARE, that is a military-based plan for veterans and their families. So now in this situation, the City of New York and the unions negotiated that we are going to have copays for the very first time in 50 years. Now, how are these seniors going to afford copays? Especially you have two spouses, you know, a husband and a wife, or a couple, and there's two people in the same household, or a parent and a disabled adult child, and now they have copays for both of them. Think about what that's going to cost a family on a fixed income, and how were they going to do that? Traditionally, in that situation with veterans, they just would have put that right through their TRICARE plan, and it would have been covered. So now this is purely out of their own pocket, according to what Kim Parker from the Alliance Emblem Empire is saying. The next part of this video I want to bring you to is at the 42-minute mark. Let's see if I can get as close to it as possible.
To keep their Aetna coverage, they can do so during the opt-out period, but bear in mind they will now pay the buy-up premium to keep the Aetna plan. And the buy-up premium is actually the cost difference between the New York City Medicare Advantage Plus plan premium, which is $7.50, and the cost of the other programs. So that's where the buy-up premium is determined. So whatever your buy-up premium is today, assume that it's going to be at least $190 more than what it is today.
All right. I have a member talking about his wife who's not a New York City retiree. She has her own Medicare, and she's on his secondary GHI senior care. So you've already answered that question. There is no coordination of benefits on the new program. So she'll have to either stay where she is or opt into the city plan.
Correct. Yes.
Okay.
And so why is that important? Because if his spouse is on her own Medicare, but using the retiree's supplemental plan, now the retiree has to do, his spouse has to do whatever he does. If he chooses the MA plan, she's out of luck. She will not have his supplemental to use. And that means if she has to opt out of city plan altogether and purchase a private supplemental on the marketplace, she now loses her Medicare B reimbursement because she had to leave the plan to get a supplemental. The only way for her to stay in is to stay in the city plan. And if her husband chooses to go to the MA plan, then they're both in, or they both have to opt out of the MA plan, stay in senior care. If at this point in time, they were imposing that penalty premium of almost $200 on us, and then the both of them would have had to pay that. Non-reimbursable, only Medicare B would be reimbursable. So they'd be out almost $400 a month. The last part of this video is about here.
Or AARP, and you pay for it yourself. If you're enrolled in the MA program, you can.
Let's go back a little bit.
If you, right now, those of you who are enrolled in senior care, which is again a traditional Medicare model, and some of you, we're all on the SBA drug plan. Some of you opt into an independent PDP program, prescription drug program, something like Humana or AARP, and you pay for it yourself. If you're enrolled in the MA program, you cannot have an independent drug program, again, like the AARP or the Humana. So if you're currently in those programs, one of those programs supplementing the SBA plan, you cannot re-enroll in one of those plans. What will happen is it will disenroll you from the Medicare Advantage, from your medical and hospital. We've had a lot of talks with the city of New York, and as I said earlier, the city of New York and the Municipal Labor Committee have agreed to allow members who are looking to opt in to have additional pharmaceutical drug coverage to opt into the city PDP, which is a direct part of this program. It's a rider to this program. You'll have to do that during the changeover period. You'll have to opt into the drug rider if you so desire. I want to be clear, you are not losing the SBA coverage. This is to a small group of members who elect to get additional supplemental drug coverage. Those people who are currently enrolled in an independent prescription drug program to supplement our plan are going to have to disenroll from that plan. And if they want the additional coverage, they'll enroll in the rider to this Medicare Advantage program on it.
So this is super important, because what that gentleman was saying is right on, hits the nail right on the head. I want to share with you a memo that came out by the MLC and Labor Relations. And why is that important? Because it speaks specifically to this prescription drug issue. January 21, 2022, City of New York, MLC, group prescription drug options for Medicare, Medicare retirees. If you want prescription drug coverage, you must elect one of the options below. First, it's important for you to know that you cannot be enrolled in an individual Part D prescription plan, PDP, like this gentleman was saying, on the marketplace, like an AARP plan or one of those plans that is not sponsored by an employer group or union, such as AARP and the New York City Medicare Advantage Plus plan. If you are enrolled in an individual Part D PDP, prescription drug plan, you will be automatically disenrolled in that individual Part D PDP when you are enrolled in the new Medicare Advantage Plus plan. If you enroll in the PDP plan after you are enrolled in the New York City Medicare Advantage Plus plan, you will be automatically disenrolled from the New York City Medicare Advantage Plus plan. So this is ridiculous. You're either going to lose your health care or you're going to lose your drug coverage if you're not realizing that one is going to have an effect on the other, right? So this will get scary. If your union's welfare fund offers a prescription drug program, and it does have a maximum benefit limit, and we've done videos on this on our YouTube channel, where you have Mr. and Mrs. Shenton, where they have a drug cap, and she takes a very expensive medication, and it's not going to be covered. And actually, in her situation, her welfare fund won't even cover the drug in the formulary. But let's say your drug would exceed the welfare fund cap, you need to purchase the rider plan. So you have to disenroll from your private PDP, enroll in the city's optional rider at $125 a month. I'll get back to that one in a second, because that's another issue. So now you're enrolled in the private, and you're enrolled in the high option rider, but you can't use the rider until you've exhausted the welfare fund cap, which for some people will happen sooner than later. But what are you doing? You're shelling out $1.25 for every month, waiting to get out of the welfare fund plan till you hit that cap until you can get into the high option rider. How many months that ends up being that you're spending $1.25 until you can actually use that plan, I don't know, but holy cow, that could add up. It could be 6 months or 5 months or 4 months, and then guess what? You're still shelling out $1.25, $125 until you can actually get into that plan. That's insane. Whereas in Ms. Shenton's case, the lady that was in the video that we did on YouTube, Mr. and Mrs. Shenton, she pays about $30 a month for an individual PDP on the marketplace that covers her drug, which is over $12,000 a month. You heard me right. And yet the city wants to charge us $125 a month. How is that possible? Continuing on, you can purchase Emblem Health's optional rider as a supplement if you believe you will exceed your welfare fund's prescription drug limit. You must first use your union's welfare fund plan up to the maximum benefit limit before you can use Emblem Health's optional rider. Any out-of-pocket costs you have when you use your union's welfare fund plan will not carry over or count towards your true out-of-pocket troop amount for Emblem Health's optional rider. Once you use Emblem Health's optional rider, your out-of-pocket costs will start at 0 and begin to calculate. You get screwed twice. And this is what I've been saying to unions is, why did you allow this? How could you do this? This is going to bankrupt your funds. Whereas before you would have had a retiree that said, oh man, you know, my medications are going to be so expensive, or they're not covered in this formulary. I'm not even going to touch the union's welfare fund plan. I'm just going to go get a plan out on the marketplace. Hell, they're 30, 40, 50 bucks a month. Now you get stuck in this MA plan that they want to force down our throats. You cannot use that private PDP. You must use your union welfare fund first, and you must max it out before you can get out of it. Hello, union. They're not happy, especially the small unions who have caps, 5, 10,000 caps, or they have a small union welfare fund. They will never survive, because now in this situation, like where the Shentons, she would not have gotten out of, I think, February. She wouldn't even got through February before her husband's welfare fund would have maxed out. It wouldn't even have paid for her to go into that. So now the union knows that, well, there's one less retiree that I have to worry about, that their $5,000 max to, that can go towards other retirees or other union members within their welfare fund. Now, not so. That fund has to be maxed out before they can even move into the high option rider. That is completely insane. And how the bigger, well, and I'll tell you, DC 37 and the UFT don't really care. DC 37 has no max on their plan, and UFTers the teachers from the UFT, they have to buy the rider. They don't offer a welfare fund plan for drugs. So it doesn't affect them. Who does it affect? All of the small unions. And this is why I don't understand even why the MLC exists, because if the MLC can have a weighted vote, and it's not one union, one vote, that the two biggest unions, the district council and the UFT, have the highest weighted vote, that whichever way that those two unions vote, that they get their way they want, they screw everybody else. It is so frustrating to keep having to talk about this, and I don't understand. I get calls from small unions all day long that find us, find our videos, find our organization, and they go, you don't even know. Let me tell you what's happening to us. And who's their president, union leader, the union president? I'm like, you're under the district council and they're not doing anything about this? No way. Absolutely. Kid you not. Okay, so this is the Nespoli letter. The MLC letter, drug plan, I spoke about that. So to read that, reread that, to make sure I've answered all of that part, is with the Medicare Advantage plan, you can have no other insurance plan. This includes your spouse's plan or a private Part D. Drugs that exceed the welfare fund, if available or aren't in the formulary, require the retiree to buy a private Part D plan. And then there was my footnote. The Medicare Advantage requires you to exhaust the welfare fund before the rider can be used, thereby draining the union's welfare fund. The retiree must pay $125 a month for a plan that they can't use up until the welfare fund benefit is exhausted. So I answered that thoroughly. The last question, CMS subsidy drops, what do you do? What will happen if the CMS subsidy that funds the Medicare Advantage plan reduces? If the CMS subsidy that funds the Medicare Advantage plan is ever reduced, the city would have to decide to pay the difference, pass the cost on to the retirees, or renege on the benefit altogether. Now, in that, I have two places to bring you to show you that. One is going to be the evidence of coverage again. This is page 280 of the 312-page document. That's a contract between the City of New York and the Alliance. Section 10.02, reductions in federal and state and/or city funding. This agreement is funded in whole or in part by funds secured by the federal, state, and/or city governments. Should there be a reduction or discontinuance of such funds by action of federal, state, and/or city governments, the city shall have in its sole discretion the right to terminate this agreement in whole or in part, or to reduce the funding and/or level of services of this agreement caused by such action by federal, state, and/or city governments, including, in the case of a reduction option, but not limited to, the reduction or elimination of programs, services, or service components. Now what? Now, that means if CMS, the Centers for Medicare, reduces the funding for the Medicare Advantage plan, which is supposed to fund the whole thing basically, because they're telling us after the first year the plans are free, right? What's going to happen? Well, the city is either going to pick up the bill, which is probably unlikely because they don't want to pay for anything. They'll either pass the bill on to the retirees, thus now draining more money out of a poor retiree on a fixed income's pension, or they'll just reduce the benefit. Do you know what they did in the past? They canceled the benefit. Let me show you. So in 2017, Emblem Health, woohoo, check that out. In 2016, there was this negotiation because they were setting the rates for 2017 for HIP VIP with, and here's the letter from Emblem to the Director of Labor Relations, Employee Benefits Program, Georgia Gesley. With the 2017 CMS revenue reductions to EGWIP, the employee group plan, revenue reductions, and county rebasing projected to result in a 7.9 reduction revenue, the City of New York VIP Medicare Advantage program benefits will reflect the following benefit changes effective January 1 of 2017. Now, in case you can't see this, I'm going to make this just a little bit bigger for all of you. Specialist office visit co-payments will increase from $25 from $15. ER co-payments will increase to $75 from $50. Inpatient facility admission co-payments will increase to $100 from $0. Durable medical equipment coverage at 20% co-insurance. The prescription drug plan in the base plan will be removed. The prescription drug coverage will only be offered through an optional rider at the existing cost sharing levels of $10, $15, 50%, 25% with an unlimited EGWIP benefit design. The rider is $155.47. And then below is their copay for their copay breakdown. So if you don't think that the city is going to reduce a benefit, this is just another way of getting rid of you. There's nothing to guarantee that they will not do this. This is why we keep saying, don't mess with this. We are protected with traditional Medicare and supplemental. You are protected. This is a benefit that was earned. This is a benefit that was legislated. This is a benefit that back in 1966, when Medicare went online, Elected officials, unions, retiree groups, politicians all went to city council to make sure that retirees, who the city was still paying for their insurance and retirement, had the benefit still. Let's go into this new national plan. Let's still pay for their Medicare. So we're still paying for all of their benefits, just like we were before, because it's cheaper this way. They're paying $200 a month for this GHI senior care plan, $190 a month, right? Then in order to continue to pay, because remember, before Medicare, the city was paying for your entire health plan, the same plan as the actives plan, right? This was the same amount. But when Medicare came online, Medicare was covering the first 80% of the bills. So how would they be able to save money? Well, they carved out the GHI or the HIP, whatever plan that you were on, made it a supplemental, and paid the last 20%. That's why that is a small plan. It only pays for the last 20% that isn't covered by Medicare. So now you have that small bill where your plan's like $900 a month, ours is just under $200 a month. So now it's a huge difference. Now you start adding in the Medicare B reimbursement, the Medicare B premium. So the city said, you know what, we were paying for those retirees' entire premium. Even with the Medicare, it's still cheaper than the whole plan for the actives. Let's do this. And they did. And it's been going on like that since 1966, 1967. So please learn your history, learn what the differences are between Medicare. We have successfully used the city's own documents, contracts, the webinars with Kim Parker and the Alliance to show you that everything in this video, in this email that we sent out, in this letter, the difference between Medicare and traditional Medicare is 100% factual. We used their own documents to do it. So with that, I'm going to close part 4. Because I believe we have proved our case, and I think we are going to prove our case come the fall when we go back before the appellate court, that this is not something that should be changed. This plan that the city wants to convince you mirrors senior care, is the same as senior care, and gives you all these free perks at the end, like these crazy rides and meals and Fitbit and whatever. That's just fluff to guide you. Hey, don't look at all that. Come look at this free stuff. Oh, don't look at that prior authorization. Look at this Fitbit. Let's look at I'm going to give you free rides to the doctor's office. They don't want you to see the meat and potatoes under the cover. They just want you to look at all the freebies so you don't look over there. Don't look behind the curtain. So with that, thank you for following. Thank you for listening. Thank you for giving us the time to explain to you that there are differences in these plans. You are being lied to. Our unions, our former unions, the actives, you're being lied to, being sold a bag of goods that's not good. We want you to know what you're giving up, because this is your give back. It affects us today, it affects you tomorrow. And if you allow the city and the MLC to carve out our healthcare benefits and force us into one plan and strip us from the ability to choose all of our other healthcare plans, the 14 options that were in the last video that the city had offered us prior to last year, you are setting yourself up to be put into the same place, because the city is going to say, well, hey, why can't we screw you too? You just screwed those retirees. We could do this to you too. We're going to kill all your plans and just stick you all in HIP for the rest of your careers. Don't think so? I've already showed you they can do it. So enjoy your weekend. Thank you for listening. Please subscribe to our videos. Stay tuned. We will be having more videos. We will be having more webinars. Please call your former unions. Call your unions if you're active. Let them know you've watched these videos. Share it with them, because we're calling them. We don't have their email addresses. We don't know them. And they're not, the receptionists at their offices are not giving us their emails to send this information to. They don't want to know it, and they don't want you to know it either. We want you to know. We were in your shoes. We know what this is like. We know what we did. We know what we earned. We know what you have. And we want you to appreciate the luxury of what you do have and not think it's not important and let it go away. So join us Our website is nycretirees.org. We have a Facebook page off the same name as NYC Organization of Public Service Retirees. Join us, learn, ask questions. We will answer all of your questions. Reach out to us. We want to educate you and we want you to learn. Please pass this information along to your delegates, to your representatives, to your unions, and help us help you. Have a great night, everyone.